it necessary sometimes to do combination procedures when it comes to the breasts?
Absolutely. Sometimes a person may come to you or to a plastic surgeon and say that they just want a breast lift. And when the plastic surgeon examines them, they realize that if the breast lift is just done, the breast becomes so small by removing the excessive skin that they really will have a smaller than an A cup, for example. In those cases, it's important to also do a breast augmentation at the same time in order to get the best possible shape. At other times, a person may need a lift and a reduction at the same time. So combination procedures for the breast are becoming more and more common.
Who qualifies as a good candidate for combination procedures?
The most common candidates for combination procedures are people who need a breast lift and an augmentation together. Generally speaking, these people are young and healthy, but oftentimes they're people who've had pregnancies and who've lost their volume of their breast and have lost the fullness of their breast, causing some degree of sagging or drooping of the breast.
How are combination procedures done?
Generally, there's done with placing an implant, for example, underneath the breast or the breast muscle, and at the same time doing a short scar breast lift operation at the same time.
How long is the recovery after a combination procedure for the breasts?
The recovery time is not more extensive than doing a single procedure on the breast. It's usually about 1 week.
And what should an individual who's getting a combination procedure look out for?
I think the most important thing to look out for is not to miss the idea or the diagnosis of needing a combination procedure, because for many people it's not very apparent. They may think that they can get away with just doing a breast augmentation, for example. Mm-hmm. But it's only after a physician can see them and examine them that they realize that they also will require lift to get the best possible result.
So after they've done this combination of procedures, how long before they can get back to a normal routine?
Generally speaking, the recovery for this operation is about 1 week.
And if an individual really wants multiple operations done on their breasts, what's the first step that they should take?
The first step to take is to see a well-qualified plastic surgeon. The surgeon can tell them if they need a lift at the same time as their breast augmentation. The importance of that is that if they do a breast augmentation and they do not do the lift at the same time, they may have a deformity of their breast called the double bubble deformity. The double bubble deformity is when the breast sags over the implant and it's not attractive at all, and you definitely need to fix that. And that's the most important thing for a person to know before undergoing a breast augmentation procedure. Only a plastic surgeon can tell you whether you need that or not. And if it's misdiagnosed or if it's not picked up at the same time that the person is having this procedure done, they may not have a very good result.